Hello everyone. Today we'll introduce a psychological illness, anxiety disorder. Let's get started and learn more together. Do you often struggle with insomnia or wake up in the middle of the night, gripped by anxiety about what tomorrow might bring? Sometimes you may even experience sudden panic attacks, leaving you paralyzed or trembling uncontrollably. You are not alone. Even the well-known actress Kendall Jenner has openly shared her experiences with such struggles.
I remember being really young, I'd say like 8, 9, 10, like around that time, and I remember having shortness of breath and going to my mom and telling her that. In hindsight, now I know that that was obviously anxiety. I think being overworked and like being in the situation that I'm in now is kind of what like set it out of control in a way. I've had times where I feel like I need to be rushed to the hospital because I think that like my heart's failing and I can't breathe and I need like someone to like help me. Sometimes I think I'm dying. Sometimes parts of my body will go numb and it can be really, intense and scary.
Watching this, have you ever wondered, I sometimes feel anxious. Does that mean I have anxiety disorder? Don't worry. First, we need to distinguish between anxiety and anxiety disorder. Let's get one thing straight. Everyone experiences anxiety. It's a normal emotional response to stress. Anxiety happens when you are facing pressure, like preparing for an exam, making a big decision, or dealing with an unexpected situation. You might feel tense, scared, or notice your heart racing and palms sweating. These are all perfectly natural reactions. But for some people, those who are more sensitive, this anxiety doesn't go away. It lingers, and sometimes it even shows up out of nowhere, with no trigger or stressor in sight. That's anxiety disorder. What is anxiety disorder? According to Diagnostic and Statistical Manual of Mental Disorders, 5th edition, it is a very common psychological disorder characterized by significant and uncontrollable feelings of anxiety and fear such that a person's social, occupational, and personal functions are significantly impaired. There are several types of anxiety disorder, including generalized anxiety disorder, specific phobia, social anxiety disorder, panic disorder, and so on. What are the symptoms of anxiety disorder? People with anxiety disorder might experience symptoms in 4 main areas: physical, psychological, cognitive, and behavioral. Physically, they may feel their heart racing for no reason, have shortness of breath, sweat excessively, feel muscle tension, or have an upset stomach. Psychologically, it's like constantly being on edge, feeling irritable, anxious, worried, or easily fatigued and frustrated. Cognitively, they often expect the worst to happen, obsess over negative experiences, replay past events in their mind, or feel like time is speeding up or slowing down. Behaviorally, you might notice they act impulsively, react too strongly to situations, have trouble focusing, or engage in avoidance behaviors. Many even end up feeling double anxiety, being anxious about their anxiety. How can we beat anxiety disorder? The most important thing in fighting anxiety disorder is seeking help from a professional healthcare provider. This typically involves 2 main approaches: medication support and psychological therapy. Medication support involves using antidepressants or anti-anxiety medications to calm down the overactive parts of the brain. Don't get too excited. It's a safe and effective way to help. Psychological therapy focuses on working with a psychologist to discuss whether the excessive worries are rational, understanding the root causes of anxiety, and helping us shift our thinking. Techniques like hypnosis or muscle relaxation training can also be used to ease psychological stress. According to the World Health Organization, more than 374 million people worldwide suffering from anxiety disorders, or 4% of the world's population. As the pace of modern life accelerates and social pressures increase, the prevalence of anxiety disorders continues to rise. Women are about twice as likely to develop anxiety compared to men, and it typically starts before the age of 25.
Your depression is a signal. If you're depressed, if you're anxious, you're not weak, you're not crazy, you're not in the main a machine with broken parts. You're a human being with unmet needs.
Anxiety often stems from a deep desire to improve, to do better. But life is full of things beyond our control. That's okay, don't be afraid. Just ask for help from those close to you. Instead of focusing on what we can't change, try shifting our attention to what is within our reach. Focus on the present moment. That's all for today. Thank you.